My name is Curtis Elliott. I'm an orthopedic surgeon with Steadman Hawkins Clinic of the Carolinas, Greenville Health System. I grew up in Georgetown, South Carolina. Went to high school there, and then went to Duke University. Followed that at medical school at the Medical University of South Carolina in Charleston. And then I was here for 5 years in Greenville and did my orthopedic internship and residency with the Greenville Hospital System. And then I did an additional fellowship year in arthroscopic surgery and sports medicine at the University of Virginia in Charlottesville. After that, in 2001, I joined private practice in Conway, South Carolina, and have been practicing there for the last 11 and a half years prior to joining Steadman Hawkins in January of this year. My practice, for the most part, elective surgery-wise, is mostly knee and shoulder, everything from arthroscopic surgery all the way to replacements of the shoulder and the knee. But I also do fracture work throughout the entire body. So one of the exciting things about joining Steadman Hawkins was I had the opportunity to be a leader in this new facility in the Powdersville, Easley area. So Medical Center of Powdersville opened simultaneously with the Steadman Hawkins new office, which I'm heading up. And so I think it's very exciting because we're kind of the first ones there with Steadman Hawkins bringing really what I think is a higher level of orthopedic care and easier access to the residents of Powdersville and Easley. My favorite thing about being a surgeon is fixing things. I think a lot of orthopedic surgeons will say that is the opportunity to have a task or a problem and think it out, think it through, and see it from beginning to end. And I think that end part is one of my favorite things, is getting people to a conclusion or through with their injury or over their injury and back to their activity or sport they want to do. Or whether it be an older person who has arthritis and performing a joint replacement and getting them back to a more of a normal life they can enjoy and getting them active again. I did enjoy sports a lot when I was growing up. My brother was 5 years older than me, so I was always playing with him and his age group more so than mine, but I think that probably made me a better athlete. I played a lot of golf. I played on the high school team from the 7th grade through the 12th grade. I was a quarterback of the football team in high school, and I played varsity basketball as well. So I didn't play any sports at Duke. They had a really good basketball team, and obviously not good enough for that. I did try out for the golf team after my first 2 years, after I got my pre-med work behind me, and didn't make it, but still play that more than anything, and enjoy playing golf. And right now I got a 1 handicap, but having a hard time keeping that working so much, but I do enjoy playing golf. Orthopedics in 2013 is pretty specialized. It's even hard to keep up just in sports medicine and knee and shoulder surgery. You got to go to the meetings, you got to read the literature, things change. I do surgeries differently now than I did just a few years ago. So you've got to keep up, and that's one of the reasons that I'm glad I'm here with Steadman Hawkins in an academic environment where I can stay on the forefront of those things. That being said, it's really nice to be in a multi-specialty group. I have 30 plus partners that are fellowship trained in every aspect of orthopedic surgery. So if there is a problem that I don't take care of, a complex hand injury or a foot problem that I just don't do a lot of electively, I've got partners who are some of the best in those aspects. If you listen to your patients, they'll tell you what's wrong with them. And I think doctors tend to get busy because sometimes there's a lot of patients to see, and it's just easy to do things quicker. And I think if you don't sit down and really look your patient right in the eye, ask them what's wrong, and really listen to their symptoms and their history of how they hurt themselves, whether it be an injury or whether it be a chronic problem, you're going to miss things. And so I try to practice like that. I want to go to a physician like that. I want my family members to go to a physician like that. Some of the most rewarding experiences in orthopedic surgery is joint replacement surgery. the patients are usually extremely pleased. It's usually a painful problem, whether it be a knee or a shoulder or a hip, that is really lifestyle limiting. They can't do just basic daily activities, or they may not be able to do things they used to enjoy doing, like playing golf or riding a bicycle. And to be able to change that within just a short period of time, maybe a few months, it's very rewarding. My wife and I enjoy being outdoors. She's a nurse, and obviously me being a physician, we're inside most of the week. So when we have the opportunity, like being outdoors with our dogs, taking walks, I like to play golf, which also gets me outdoors.